Okay, this is going to be the IV piggyback final for 326. Hand sanitizer, flushing syringe, tubing, my syringe here, the medications, the bag, my MAR, and my EHR. This is the patient. My mom is here recording me. This is the entire room, and the only sheet I have is the MAR. Everything else is just my equipment. Obviously, in real life, this equipment would already be pre-packaged, but I was practicing at home. And my vancomycin powder, also, it's not in the powder form, but for the video, it should just be known that it's in this. This is a powder. This has not been reconstituted yet. Okay. Okay. So I have my patient assignment for my MAR here. I see I have a Mrs. Durbin, female patient, date of birth, January 17th, 1930. Altered level of consciousness, she's confused, so we're gonna put her on some fall precautions. Temperature is 101.4, BP is a little elevated at 128 over 88, 0.2, saturation 92%. She had a tracheostomy performed. She has hypertension and type 2 diabetes, no drug allergies, but she is allergic to strawberries and bees. Current medications are Colace 100 milligrams, 1 PO BID, Prevacid 20 milligrams, 1 PO QD, Ethanol 100 milligrams, 1 PO QD, and it was just recently increased from a dosage of 50 milligrams PO QD. The only eyebrow raising concern is the ethanol, because the patient has diabetes and she also has had a tracheostomy performed. Ethanol can cause bronchospasms as well as hyperglycemia. I would call a physician and talk with him about that, but potentially changing that medication or just making sure it's okay that it's given. I also see that she is receiving IV normal saline 500 cc bolus to infuse over 2 hours, and after that is done infusing, she is going to receive LR at 150 cc's per hour. I see that my assignment is to administer vancomycin 500 milligrams per 1 ml via IV piggyback and 100 cc's normal saline over 1 hour every 24 hours. I'm now going to go into my med room. Okay, I'm in my med room, pulling up the patient's EHR. I have my MAR. Patient's file is up. So 10 rights of medication administration is right patient, right medication, right dosage, right frequency, right route of administration. Second rights of medication administration are right assessment, right evaluation, right education, right documentation, right of refusal. So I'm looking at my patient's EHR as well as the physician's orders, comparing it with my MAR. I see on their EHR, within their electronic health record, they are to receive vancomycin 500 milligrams per 1 ml via IV piggyback and 100 cc's of normal saline over 1 hour every 24 hours. That matches up. This is to be administered at 8 p.m. Yep, that matches up. Also, I'm going to check the compatibility of the vancomycin with the LR. Let me open up my drug book. Medications are compatible. So let's get ready to withdraw my medication. Just gonna type in on my MAR. Mrs. Durbin. Before I withdraw, actually I need to calculate the correct dosage. So I'm going to withdraw 1 milliliter of vancomycin. Mrs. Durbin, 1 milliliter of vancomycin. Boom. Okay, so I'm now going to prepare the patient's medication. So let me just perform hand hygiene. Okay. So what I'm going to be doing is I withdrew my medication from the drawer. I have my IV piggyback bag here of sodium chloride, which does not expire until 2027, so we are okay with that. I have my IV piggyback tubing. I have my flushing syringe. I have my diluent, which I withdrew also. This does not expire until 2028. Vancomycin does not expire until 2027. So what I am going to be doing is I'm going to take my syringe. I am going to, well, first, actually, let me wipe down me wipe down the diluent at the top for 15 seconds. I'm gonna wait 30 seconds. 30 seconds has passed. I am going to withdraw 5.6 mLs of diluent. Come closer, Mom. 2, 4. Right there, 2, 4, 5.6 mLs of diluent. I am now going to recap the syringe. I'm going to flick the air bubbles out. Fantastic. So what I'm going to do now is I am going to wipe down the vancomycin, and again, the vancomycin is unexpired and it is in a powdered form, ready to be reconstituted. It is not in a liquid. That's not happening. It is in a powder form. 15 seconds, wiping. Gonna wait 30 seconds. Now what I'm going to do is I'm going to inject my 5.6 mLs into the vancomycin. Recap my needle. Now what I'm going to do is I'm going to disperse the diluent and mix it within the vancomycin, not too strenuously. Okay. What I'm going to do now is I'm going to be wiping my IV piggyback port where I will be injecting the medication into. Okay. Now what I would like to do is I am going to extract 1 milliliter of vancomycin to inject into my IV piggyback bag. So we have 1 ml right there, 1 ml. Perfect. So I'm just going to now recap this. One ml. I'm gonna just flick out the air bubbles here. What I'm now going to do is I'm going to inject this into my IV piggyback bag that I sanitized. There we go. 1 ml has been injected, 1 ml of vancomycin has been injected into my IV piggyback bag. I am now going to proceed into the patient's room with my tubing, my plunge, my flushing syringe, my IV bag, my MAR, and the patient's EHR. Knock, knock. Hi, my name is Matt. I'm gonna be your nurse today. How are you doing? I'm gonna just perform some hand hygiene. Doing okay? Great. Before I do anything, I just wanna quickly let you know I'm here to administer your medication, but I wanna just confirm your name and date of birth really quickly. Is your name Mrs. Durbin, born on January 17th, 1930? Yes? Yes, it was? Yes, it is. Great. And do you have any allergies to medications? No, you don't? Do you have any allergies at all? You're allergic to strawberries and bees? Fantastic, that's also what I have here. So, have you ever received vancomycin before? That's the medication I'll be administering to you. No, you haven't? So what vancomycin is going to do, it's going to help treat the current infection you have. It's very, very good at treating staph as well as streptococcal bacteria, but I just want to let you know you may experience some side effects with this medication. You may experience hypotension and dizziness, which is why I'm going to place a commode right here, and I'm going to give you this call bell light, because this medication with its side effects are going to put you at fall risk, especially with these side effects of hypotension and dizziness that can be displayed. So if you have to use the bathroom, even though there's a commode here, just use the call bell and I'll come in and I will provide assistance with you. And I'm just gonna verify again with my MAR, I have Mrs. Durbin to receive vancomycin 1 milliliter via IV piggyback and 100 cc's over 100 cc's in normal saline over 1 hour every 24 hours. Okay, I'm just going to now scan your wrist. I'm going to scan my medication as my last check. I am now going to let me do hand hygiene one more time. I am going to glove up and assess the patient's catheter site. All right, so upon looking at the patient's catheter site, no signs of phlebitis, no inflammation, no redness, no signs of infection, really. I'm gonna just palpate. I don't feel any tenderness. Mrs. Durbin, does this hurt? Are you in pain? No? No pain? All right, great. Before I do anything, I just wanna wipe your IV site down with the sterile swab alcohol. Just wipe your port area. Fantastic. So what I'm going to do is I'm going to flush the IV site to make sure there's normal blood flow of medication. Okay, I'm going to connect this. Okay. Oh, okay. Yep. We do have a proper blood flow of medication. So what I'm going to do now is I am going to prepare to administer the IV piggyback. So what I'm first going to do, I'm going to uncap. I'm going to wipe the site down. Going to connect my tubing securely. Okay, tubing is connected. All right, so we have the tubing is connected, and what I want to do now is I want to I want to back prime the IV. So this IV would obviously be connected to a machine when doing this, but for the purpose of this video, I'm going to be testing the back priming just standing here. And what this is going to test is for air bubbles, as well as to make sure that the IV is going to flow. So I'm going to take my cap off. Actually, I'm going to leave my cap on for right now. Okay. Just make sure that this is dripping. Yep, and there is flow. So now what I'm going to do is I'm going to uncap and test for flow over the garbage can. And how I'm going to do that is I'm going to slowly unclamp. Okay, there is flow. So now what I'm going to do is I'm going to connect the IV I'm going to connect the piggyback bag into the patient's IV. Okay, we are all connected. I'm going to attach it by gravity up here. I'm going to unclamp it. I'm going to be setting the rate. I'm going to set the rate at 101 cc's per hour, and the patient already has 250 cc's of normal saline running every hour, or 500 cc's every 2 hours, as well as their LR that's running at 150 cc's per hour. So IV is all connected, attached by gravity. Okay. All right, Mrs. Durbin, you're all done. I'm gonna just take these gloves off, perform hand hygiene, as well as just give you a quick rundown. So, Mrs. Durbin, today I administered vancomycin to you via IV. I'm going to monitor the patient, and I'm going to be monitoring you, Mrs. Durbin, within the next 30 minutes very, very closely for hypotension, red man syndrome, as well as the patient's labs of BUN and creatinine to be aware to see if there are any signs of nephrotoxicity. If those lab values are out of range, could indicate nephrotoxicity. Again, Mrs. Durbin, if you need to get up or you need to use the bathroom, please hit the call bell light, because this medication demonstrates signs of hypotension as well as dizziness, and that can place you at a very, very higher potential to fall. And regardless, I am going to be monitoring you for the next 30 minutes, but do not hesitate to use that call bell light. I'm going to go now document into your electronic health record that I administered IV piggyback medication of vancomycin at 1 milliliter in conjunction with your current running IV medications, as well as I'm going to document that the IV site looked totally and completely clear, no signs of infection, no inflammation, no tenderness, no redness, no pain, no erythema. Have a nice day, Mrs. Durbin. I'll be back in 30 minutes.